Hello everyone, welcome to Radiology cases tutorial. Here we are going to discuss the hepatic cysts in the different patients. Hepatic cysts show the classic findings. Hepatic cysts are mostly rounded and they shows regular margins with acoustic enhancements. And here we can see that this is a round structure. Also shows the acoustic enhancement but shows a peripheral pucking. It means that they shows partial internal septations, which is frequently seen. Otherwise, the simple hepatic cysts. Now here you can see a very small cyst that size is less than 1 centimeter. That is called a subcentimetric cysts, and it has regular margins and rounded, and also shows acoustic enhancement that is very minimal. And here CT confirms this subcentimetric cyst. Now this is a type of hepatic cyst that is hemorrhagic and showing the internal blood clots. And it is also rounded and shows acoustic enhancement, and it has also regular margins. And this is a cyst with a solid retracting internal clots and also rounded and shows acoustic enhancement that are the sonographic features of the simple hepatic cysts. Now this is a case of hepatic cyst with multiple internal septations, internal membranes, and the solid mural thrombus. And here we can see the cyst with the diffused low level echoes and obvious through transmission, that is called the acoustic enhancement. Here we can see. Now this is a very interesting case that shows a pseudo aneurysm simulating a simple hepatic cyst. The grayscale view of the liver shows an anechoic structure with a well-defined back wall and increased through transmission, acoustic enhancement with a well-defined back wall and increased through transmission. This is a typical appearance of a simple hepatic cyst, but the Doppler analysis shows a swirling flow throughout the lesion consistent with the pseudo aneurysm. Now this is another interesting case. We can see a polycystic liver disease, and the transverse view of the liver shows the multiple simple cysts with a little detectable normal hepatic parenchyma, and they are mostly rounded and shows acoustic enhancement with regular margins, and their CT correlative shows the similar findings that was detected in the ultrasound.